Biotronix Pneumatic Shockwave Therapy, Radial Shockwave Therapy, Extracorporeal, and the power of the energy is of the same is up to 10 bar. This is a 10 bar machine. This is a pneumatic compression based machine. You can see this is quite heavy in weight, around 15 kg, and this is the accessory case. You can see these 1 2 3 4 5 6 and 7 heads, different heads are there according to the treatment area. 1 2 3 4 5 6 7, and you can see this is the gel, and these are the tools to open this head while when the bullet get consumed. So we are having also providing the spare bullets. You can see there are 3 spare bullets in the same, and one is in the same, and one bullet gives around 3 lakh shots. So you can get up to around 12 lakh shots from this device. After the bullet, all the bullet get consumed, you have to buy the other bullets to use in the same. And this is the operating cable, you can see, and this is the cartoon. You can see the same is getting transported, putting in the same cartoon, so to avoid the damage and all. You can see the quality of the same, the hardness of the same. Now I will show you how to operate the device. You have to switch on the same from the back side. You can see at the back side there are 2 fans and 2 filters are there, while the other devices have 1 filter or 1 fan. We are having 2 fans to cool down the system and 2 filters to filter the air coming in. Now I switch on the machine from here. You can see this is the touch panel, and it's showing you waiting. The machine is getting, the compression is getting start on. You have to press the screen, it will be starting, it will get start, and you will see that there are 10 treatments area over here. This device has the treatment area for the physiotherapy, for the erectile dysfunction, ED therapy you can see over here, and for the slimming there is a program for the fat accumulation. So this is the elbow, knee and all the treatment areas. These are already pre-programmed treatment area. So you have to select the same and operate the same. Now I will show you how to operate the same. This is the, like I select the knee treatment area. So in the knee treatment area, you see the pre-selection is 3000 shots. So according to the same treatment area knee, the pre-selection shots are 3000. Currently the counter is 0000 because I haven't used the same. When I will use the same, it will count the shots and it will keep on increasing, and when the same will reach up to 3000, the treatment will be switched out. You can also stop the same in between using the switch in the touchscreen or using the switch in the probe. I will show you. This is the preset frequency 10 Hz, and this is the preset energy 3.5 bar. You can increase or decrease the same from 0.5 to up to 10 bar in the multiple of 0.5. You can go up to 10 bar. 10 bar is quite high in energy, so doctor has, if doctor wants the same, he can use the same too. But in the knee program, it is recommended or pre-programmed as 3. Frequency you can increase or decrease up to from 1 to 22. The frequency of the shots you can see here. Like I have put the same on 12. Now I will start the same, pressing the same. The device is ready. When I will press the same, it will start giving shockwave. You can see. It's 3 bar energy. If I increase the energy, you can see. I increase the same to 10. I can vary the frequency accordingly. Frequency increase, and if I decrease the same to, it's quite high, so I am decreasing the same to. It's counting the shots. currently 504. You can see the timer will, shots will go up to 3000 for this area. If I press the same, it will be switched off. This is a touch screen. If I don't want to use the touch screen, I have option for the mouse over here. Like you can see, if I rotate the mouse, you can see the pointer will go from all. So when I put the same mouse on the knee, I have to press this and the same will be selected. So if I operate the same, the mouse will goes like that, and if you press the same will be selected. You can increase or decrease according with the mouse. So mouse operated as well as touch screen operated. So this is the demonstration of this device. Hope this is quite understandable. Thank you.